Fellas, this has got to be a very, very exciting time to lead a healthcare center. What's it been like since you become installed?
So, exciting is an interesting word. It's been a time, but it is I'm going to play on that word because the exciting part of it is knowing that we have been here for the community. Because it's been some trying times. So when I think about some of the things that we're going through, particularly in the last month or so, it's been unprecedented. It's been trying. It's been challenging, but it is also rewarding
Mm.
when I look at what we've been able to do to really take care of our staff, and we've had to really focus on that because of everything that's going on, as well as make sure that we're here for our patients in the community.
Can you be a little more specific when you say rewarding? Because we always want to hear that.
So I think the rewarding thing is I think about what their alternative would be.
Mm-hmm.
So if we weren't here, and we've had days. Thankfully, the census is going back down, but
Mm-hmm.
we've had days where our COVID census has been over 90. Now we're starting to drop back down into the 40s, into the 30s. So when I say rewarding, I'm like, what would have happened
Mm-hmm.
to all of those people?
Mm-hmm.
And while there's a lot of focus on COVID, I think the other thing we have to remember is that all the other health issues that people deal with, they haven't gone away.
Not at all.
So people still, are having complications from chronic illnesses like diabetes and heart disease.
Mm-hmm.
People are still, having injuries, slipping in the snow, breaking, legs and arms and other things. And so the rewarding thing is that despite this pandemic, we still are here and serving this community. And that's the rewarding part because I don't know where else people would be able to go for care and service.
I'm glad you touched upon that because you come on board at an interesting time. Fell down, sort of left things in, I would imagine, a bit of a high note from the point of the community. And then, of course, you've got a new hospital that's come online this past year over at the UMD. And so that puts you in a very interesting position in terms of where you will lead the hospital next.
So we became part of Luminis Health in July of 2019. And one of the things that I think is key when you look at what we all decided, we looked at our Anne Arundel Medical Center mission and vision, our Doctors Community Medical Center mission and vision, and said, who do we want to represent as Luminis Health?
Mm-hmm.
And what we decided is that we want to focus on, enhancing the health of the people and communities we serve. So that is, I'm all about alignment with mission, alignment with vision. And so when you look at that, a lot of our focus, even in the pandemic, was how do we enhance the health of the people and communities that we serve? So early in the pandemic, that meant prior to the vaccines being available, going out into the community. It's hard to remember, but we all remember when schools closed. Of course, there's been several cycles of this, but businesses were shut down and people were home and not knowing, what they could do, what they needed to do to keep themselves safe, not
Mm-hmm.
knowing even how COVID was transmitted in those early days. So lots of fear, lots of misinformation and myths. So we took our community health team and others, and we went straight out into the community, and we started providing education, and we started providing what we called our Covert Care Kit, because there were points in time as we look now and you can buy masks. You may not be able to find, well, now it's even easier to find a test, but we've gone through these cycles where it's like, I can't find basic hygiene items, or I can't, I don't know where to go for testing.
Mm-hmm.
And so our goal has been to meet each and every one of those needs. So we started out with education, COVID care kits, and then we opened a test site, which we still run today in the city of Hyattsville, in partnership with the city of Hyattsville. First United Methodist Church of Hyattsville is our host site, and the Prince George's County Health Department is our lab partner.
Mm-hmm.
So that's still up and running 3 days a week. We also now are very fortunate with this latest Omicron surge. The state has also offered additional resources. So right across the street from our campus, we have the state and health department and the National Guard running a test site open 7 days a week. So now, people have testing resources. And then we went to vaccines as soon as they were available and as soon as we could start offering them to the community. It's like almost like a year ago from where we are now. It's hard to believe it's been a year that we've been out there offering vaccines. So we had our community partners, First United, another Methodist Church in Hydesville was one of our partners, is still one of our partners. Reed Temple, we were on their site for days and weeks at end, and now we are scheduling and have what we call booster clinics, and we're doing child vaccine clinics. So far, we actually have vaccinated or administered, I should say, over 72,000 vaccines in Prince George's County.
That's amazing.
And that is what's really helping to make a difference. So we're going to stay at it. Education, we talk about our 3 W's, which we're going to still keep talking about. Wear a mask. That's why we're all wearing our masks. Wash your hands, watch your distance, and get vaccinated and get boosted, right? So that is the playbook that we know can make a difference. But we need to recognize that there's lots of other illnesses and health issues and social issues that people need help with. So we're doing our best to meet those two, including our up and coming behavioral health facility. You may have passed it as you drove onto the campus. But we, broke ground on that last April, and we are making huge progress in the construction of that, and hope to have it open in a few short months. And that is so needed in this community. There's just been a lack of services available for people, and we need them today more so than even before.
That was actually one of my questions. I wanted to know what you feel the niche is of your hospital, given that so many other things are happening, not just with COVID, obviously, but with your vision for the hospital. Is behavioral health the niche that people need to know about? Or if you want to share with us the 2 to 3, maybe 5 different things you want to be known for.
Yes. So I would say a couple of different things. So one, we are a community hospital, which means we offer broad services. So everything from medicine to surgery. We actually are growing our surgical capabilities on our campus because of where all the needs are. So there's that's the internal work that's opening, but we have new surgeons who are joining us. We're making enhancements to our operating rooms, our sterile processing, all of those things that we need to be able to take care of the types of health conditions that we see in our community. And then when you talk about niche, I think it's important for people to know just all those general community things that we're doing. And that, if you have a medicine need, you have a surgical need, we're here to serve you. And then there's a few other areas that we're focusing on. Behavioral health is definitely one of those areas. Once again, huge needs. Our county executive, Angela Also Brooks, and many others have recognized those needs, and we're very fortunate that the county actually even granted us capital dollars to be able to put toward the construction and redesign of our behavioral health pavilion that will be right here on our campus. And it's going to offer a broader continuum of ambulatory care behavioral health services for both mental health and substance abuse. And we will be opening, now that we have approval from the state from our certificate of need, we're opening a 16-bed inpatient unit. So all of that is going to be right here on our campus. There's several other areas where we want to continue to grow and develop. We are looking at obstetrical care, or OB as people refer to it. One of the statistics that I frequently share is that currently in Prince George's County, 8 out of 10 moms go outside the county to deliver their babies. And so we want to be a game changer with that. We want to make sure that people have a quality choice close to home in which to receive care. So that's another area that we're growing. We also are growing when we look at our cancer care or oncology services that we talk about. There's a lot of need for additional screening, and then there's a lot of need for treatment when
Mhm.
people are diagnosed with cancer. So some of those are ambulatory-based services that we're looking at, and then the full complement of, radiation and chemotherapy infusion centers and those type of things, to be able to really just make sure we're meeting the needs of the community. It's there's our goal is really all centered around the community. So we look at the community health needs assessment, other data that's publicly available, and really try to assess where there are unmet needs,
Right.
and then look at what are those services that we can offer to meet those unmet needs.
I understand completely. I know we're pressed for time, so I'm going to ask you these next few questions kind of in rapid fire, if you don't mind.
That's
Just
fine.
so that I can make sure I get as much in as possible. And so, when it comes to the next steps after COVID, what are the things that we should look forward to in addition to the Behavioral Health Center?
So I think we can look forward to our surgical expansion, behavior health, definitely want to make sure that that's in there, and then just really partnering with the community. That's going to be a huge focus of us. It's been difficult during COVID to have certain meetings, even though we've all learned how to maximize all of our online platforms like Zoom and Teams and everything else. But in order to serve the community, we have to be and remain closely connected.
Okay.
So we're looking to continue to expand our community partnerships, coalitions. One of the areas that we know it's great needs is diabetes. We have way too far a high prevalence of diabetes in this community. Many people don't even realize that they have it. So that's a lot of the work that we're going to be doing going forward.
When it comes to the hospital being part of the community, can you elaborate? Are we talking about health and health exclusively? Or are we talking about some things that are a little more social oriented, more cultural oriented, more integrated?
I would say it's all of the above. And the reason I say that is because the two, you can't separate them, right? There are things that happen in, that some people, social needs actually influence healthcare needs. So we have to focus on all of it. We can't by ourselves do it all, but there is power in coalitions. There's power in community partnerships. We can be a convener of that. We can bring all the right stakeholders to the table, and we can make an impact.
What are some of the things that you bring to the table as new leadership, particularly as an African American woman? What are the things that you bring to the table that are sort of different from what might have been before?
So I think, one of the things I would say is that this is my community. So I was born in D.C., raised in Prince George's County, and have lived in Prince George's County almost all of my life. So I call myself a lifelong Prince Georgian. So when you live here, and I've seen everything from, from desegregation and busing to changing demographics in the county, to, just seeing what my own family and friends and neighbors are going through. So I think that just gives me a unique perspective of someone who, this is my home, this is my community that I care about, and I've lived here, and so I know what some of those needs are.
How do you feel that you're able to address them? Again, keeping COVID aside, we all know sort of, but how do you feel like you're in a position to address them?
So I think we are in a good position to address them. One of the things that I think when you mentioned social needs, this summer, in the summer of 2020, with the murder of George Floyd, there was this awakening of all of the social injustice and racism, structural racism, and all of those issues. Not new, but just kind of bubbled up to the surface again. And we recognize that we have to be a part of addressing those issues as well. So here at Luminis Health, we formed what we called our Heart Force. And Heart Force stands for, it was our Health Equity and Anti-Racism Task Force. And we brought together members of the community, members of our governance board, employees, other community partners, and put together an entire agenda around how we, not waiting for anyone else to do it, but what are the things that we can do to address health equity and racism. So I was a member of that group and still one of the leaders driving some of those efforts. It involves everything from making sure that our workforce is reflective of the community that we represent. So we have lots of initiatives around, improving and increasing the diversity of our workforce, particularly at the leadership level. Want to see others like me in leadership roles at all levels. So that's one of the things that we're looking at. We also are looking at, how we can continue to build the economic engine here in the county. So when we talk about that behavioral health center down the hill, we actually have made a very strong commitment to spend dollars with local and minority business enterprises, because that's how you invest back into the community where you are. We have invested in our workforce, and we've made a $29 million investment in our workforce. One of those components was raising our minimum wage to $17 an hour so that people can have a living wage when they're working here at Doctors Community Medical Center.
Right.
So all of those, is many, many other things that we're doing around, cultural humility and training and education for our staff. But all of those are such important initiatives. Once again, we are in the community, we're a leader in the community, and we're going to be a part of improving the community for all of us who live here.
That's outstanding. Thank you so much. Actually, two more questions if I could.
Sure.
And so, given the things that you've had to overcome to get to where you are, can you tell us if you ever saw yourself in this position? And if so, what was that moment like? And if not, what is it like now?
So it's kind of interesting that you asked that. I think back sometime and I reflect on some experiences that I've had in my life. So one of the elementary schools that I went to is a mile on Good Luck Road, same road that the hospital was on. And I was sent to that school with mandatory Lamont Elementary School on Good Luck Road. And I was bused to that school when Prince George's County implemented busing to try to desegregate the schools. And, at that time, it was not necessarily a good experience because we weren't treated well. You felt like you weren't wanted. So I went from those kind of experiences to, parents in my family who have always said, to all of us, myself, my siblings, the world is yours. You can do whatever you put your mind to. And I graduated from Eleanor Roosevelt Science and Technology program, very competitive program to even get admitted to. And that kind of said to me, and I did very well, okay, I could do this, I got this. So, I have had a wonderful career journey, starting off as a nurse, to now being a president of a hospital. So I say to everyone, whatever you set your mind to and you're willing to do the hard work, you can achieve anything.
There you go. Last question. Given today's, not pressures, but our interest in getting everyone covered, with adequate health care, how do you think we're doing, and what do you think we might need to do to improve getting more of our residents engaged in having health care and being covered?
Yeah, so the one good thing I would say about being here in Maryland, so one, we are an all-payer state. So that means that when you need care in a hospital, our rates are set by the state, and, we will equally take care of someone with Medicaid, uninsured, or Medicare or private insurance. But we do know that, so while that's true of getting hospital care, we know that when we think about, the hospital isn't where you want to be your primary care provider. And so one of the things that I think we all have to continue to work on is how do we provide comprehensive care to every person here in the county, so that they aren't just waiting until they're very sick and coming to the emergency room. So there's still a lot of work to do with that, building up our federally qualified community health centers, our primary care network, being able to take care of people who don't have insurance, including those who are undocumented and may not be able to get insurance. So I don't want to send a message that that we're there yet.
Right.
We healthcare to me is a basic right. And so we need to ensure that that is something that everyone has access to, high quality health care. And so we're looking at all of those things, not just what we do here in the hospital, but that's one of the reasons why we're forming all of these community connections, building out our ambulatory platform so that there are primary care physicians, pediatricians, obstetricians, all of those specialties that we know people need that can help take care of them and keep them healthy. That's the goal, right? Keep people healthy.
last question. I'd like to leave on a high note. I always do. So, what time does your day usually start, and what's the most meaningful part of your day? Given the routines that
Yes,
are
yes, yes.
routines as opposed to things that kind of come up out of nowhere.
Yeah, so my day starts typically anywhere between 7 a.m. and 8 a.m. I'm here. There's some days I have meetings even a little earlier than that, but typically not before 7 a.m. But what I would say is the most meaningful part of my day and what keeps me connected is being able to, when every day I try to find, even if it's just for a few minutes and sometimes it's for a couple of hours, the opportunity to round in the hospital and connect with those that are on the front lines, with my nurses, with my techs, with my doctors, those who are really delivering the care, and make sure I stay connected to what their experiences are, any barriers that they're facing that we need to remove so that they truly can provide
Right.
excellent care and service to our patients.
Thank you so much.
Thank you.
Really appreciate your time. Is there anything that we didn't ask you that you'd like to mention?
No, I would just mention that, just we even though we're seeing our numbers getting better across Prince George's County and the state, we are still dealing with this pandemic.
Mhm.
So, last thing I would just mention is really encouraging people to get vaccinated, to get boosted when they are eligible for their booster shot, to seek information if they have questions about the vaccine, and then our 3 Ws. Because everybody can do that always. Wear your mask, wash your hands, watch your distance.